Hi, I'm Brad Cipriani with Conservative Orthopedics. We're going to go through a developmental sequence that starts off with what it means to develop trunk stability and then progress through some transitional movements. The sequence is designed based on developmental benchmarks that we go through, developing from a baby to a toddler and then progressing into developmental stages as we age. So we'll start with some basic stuff laying on our back, and then subsequent videos will transition more into other patterns. And my dog may be around for these videos. So starting off, laying on your back, we're going to talk about what it means to engage good trunk stability. So starting off here, you're going to lay on your back with your knees bent, your hands on your belly, and as you take a deep breath in, you're trying to push your lower abdomen into your hands. And you're trying to do that without any movement through your chest. So a lot of times as we elevate our chest, it increases tone or tension in our lower back. You want to try and break that habit even from just a breathing perspective initially. So starting off, you're laying on your back, hands on your belly. Put a little bit of pressure from your hands into your belly as you breathe in. So I take a deep breath in, and as I do that, I push my belly outward into my hands, and then exhale. And then again, inhale, and exhale. Really trying to isolate the movement to my lower abdomen. Now, the other piece to this is that not only do I want my belly to elevate or expand, but I want that expansion to also happen laterally. So from here, I'll have someone maybe take their hands and wrap around the side of their pelvis or lower trunk, and not just pressing forward, but also trying to press out to the side. So if you kind of take your hands and push inward above the top of your pelvis, same thing as you breathe in, try and push into your hands. So, and I feel that lateral expansion. So I would try 5 breaths where you focus on the front, and then 5 breaths where you try to coordinate the front with the side. Nice slow breaths. Now, the last piece to what it means to keep this stability is while I'm breathing, I want to be able to maintain tension. So as I put my hands on my belly and I take that deep breath in where my belly pushes outward, I want to keep this tension here even as I exhale. So the way I'll explain it to patients is whenever you cough or laugh, that automatically creates this lower pushing out motion of your lower abdominal wall. So when I laugh or cough, I feel that push outward. It's not the sucking in that a lot of us are accustomed to, it's a little bit different. So I want to try as I can, breathe in, pushing my belly out, and then keeping that tension as I exhale. Nothing where I'm overly straining, and like I said, if you cough or laugh, it'll replicate it. I'm doing it right now, and I'm talking, I'm comfortable, I'm not overly taxing myself. Now the next piece we're going to go into is movements that bring this into play. So starting off on my back, I'm going to try and maintain that lower abdominal tension. I have it right there, chin slightly down, and I'm going to try and just lift one leg, pause for a few seconds, back down, take a little break here, same thing, apply tension, lift the leg, pause, and back down. So this will be the first very basic movement of maintaining that stability and then lifting the leg. Proactively, we want to be able to engage our trunk prior to any type of movement. We would like that to happen subconsciously so that our trunk becomes that stable foundation for us to move. This is a way that we're just trying to retrain our body to activate this prior to doing some type of leg or arm movement. So the next piece would then be this leg up, and then the opposite leg up. And now in this position, I'm going to start moving into some other more challenging activities. So keeping both legs up, I'll take my arms up here, and I'll try and keep this tension as I slowly take my arms overhead. Since I'm running into the wall, I just flex my fingers and back down. So same idea here. As my arms go overhead, my mid and lower back are going to want to arch up off the floor. I'm going to use that abdominal tension to keep my lower back very still. So as my arms go overhead, if I start to feel tightness in my shoulders, that's okay. That's probably the point I want to stop at. Because if I go beyond that, I'm probably going to want to lift my back up off the floor. So it's important to stay in that range where the back does not lift up and come back down. Tension in the stomach, slowly going overhead, and come back. Okay. Now the last position is going to be similar, keeping the tension and now movement in my legs. So tension in my stomach, and I may actually just keep my arms straight up in the air. You're going to start to slowly straighten one leg out, only going as far as you can, keeping this stability. So if I start to go too far, I may feel my lower back start to lift up off the floor. I want to stop beyond that point. So I want to stay in a range that I can control. So I'm going to keep that tension, slowly start to straighten out. If I can, I'll go all the way straight. And then coming back up, and then same thing with the opposite leg. Really focusing on that lower abdominal tension. You can see I'm once again not straining so hard that I can't talk. And even if I just go to there, that's okay. Making sure that I stay in that range where I can keep that tension and keep my back flat. So briefly, just in summary, we did some of the breathing to make sure we're engaging the right areas. We took that breathing and that tension and maintained it with a leg lift on each side. Then we went to 2 feet up in the air, and we went into an arm movement overhead. And then we maintained the position of the arms, and we did this alternating leg movement, trying to work towards taking one leg as straight down towards the floor as we can. I would recommend starting with maybe 5 to 10 movements in each position, and then progressing upwards of 10 to 20 as you feel comfortable.